PCOS or Polycystic Ovarian Syndrome. Today I would like to talk to you about PCOS because PCOS has become a very common endocrinological disorder in women of the reproductive age group. The statistics indicate that 1 in 10 people suffer from PCOS. In my clinic itself, every day I see at least 2 patients who either have PCOS at the beginning stages or they have come up with the complications. Now, PCOS statistics also say that 50% of the women go undiagnosed and 50% approach the physician only by the time they have developed complication. Now, the most common complication which we see in patients of PCOS is infertility. PCOS patients are at 3 times the risk of developing endometrial cancer. Hence, it is very essential that we understand the pathophysiology, clinical presentation, the environment, whether it's internal, whether it's external, that makes an individual prone to developing PCOS. And it is absolutely necessary that we find an integrated approach to manage this disorder. So what exactly is PCOS? Now the name clearly states polycystic ovary. That means there are multiple cysts that develop in the ovary. As you can see in this image, these are the cysts that we see on an ultrasound imaging. Now, does this mean that the problem is in the ovary? No. The problem is not originating in the ovary. Now, the main reason behind PCOS occurring is that there is a hormonal imbalance. So, what is this hormonal imbalance? Now, the hypothalamus, pituitary, and the gonadal axis is responsible for the normal menstrual cycle in a woman. When this axis is disturbed, that is when the ovulation does not occur. The cysts that you can see on this imaging are nothing but the follicles that have failed to ovulate. And this keeps on occurring cycle after cycle after cycle. These follicles remain retained in the ovary and form the cyst. Now, normally the axis makes sure that all the hormones are produced in a timely fashion and in the correct amounts. Thus, you have a normal menstrual cycle. But when this cycle or when this rhythm is disturbed, that is when the chaos in the body begins. So you can look at the hypothalamus, the pituitary and the gonadal axis as a traffic signal, So when the signal is disturbed, then there is a chaos that occurs. Chaos among all the hormones and all the levels of these hormones get affected. Whether it is FSH, LH, insulin, cortisol, testosterone, prolactin, thyroid, all of these are fluctuating, all of these levels are different. So in PCOS, what we see is that there is a multiple systems, multiple functions which get affected in the body. Hence, we need to understand why these hormonal imbalances are occurring. So why is this hormonal imbalance occurring? Why is the hypothalamic pituitary gonadal axis getting disturbed? Now, the exact cause is not known, but it is believed that the level of the male hormones or the androgens increases in the body that prevents the ovulation. So basically, if you see initially, the first symptom that occurs in the patient is the anovulation. But there are many theories that have come up that suggest, why this fluctuations or why the hormonal imbalance occurs. So there are 3 main predisposing factors that are responsible for causing the hormonal imbalance. The first, most important and the most commonest reason that we find today is stress. Now this stress can be mental or the stress occurring within the body. Now, mental stress could be anything from work stress, exam stress, relationships. The pandemic itself created so much of stress in people, the conflicts existing in family. So stress tends to increase your cortisol levels. Now, once your cortisol levels increases, your insulin starts rising in the body. Insulin resistance increases. Thus, you become prone to production of your peripheral fat increases. That is why you have the androgens which increase, and then you're prone to developing PCOS. The next reason is the lifestyle of an individual. Work from home, poor physical activities, more screen time, less physical games, easy cooked meals, fast food, all of these predispose you to develop obesity, and also your insulin sensitivity changes. And the third important factor is also genetics. So genetics also has a role to play to predisposing you to developing PCOS. The very nature of this disorder is such that it makes it absolutely necessary that an early diagnosis is made, so that you're able to start treatment along with the weight loss measures that have to be taken, so that you will be able to reduce the risk of developing the long-term complications. So now let us try and understand what is this hypothalamic pituitary gonadal axis. Once we know the normal cycle that takes place, we will know how the disturbance, how the various levels of hormones that get affected will cause the changes of the physical symptom or the pathological or structural changes on the body. Now we'll be having a quick look at the normal menstrual cycle and the hormones that tend to regulate it. As you can see in the picture, the hypothalamus stimulates or releases the gonadotrophin releasing hormone to stimulate the anterior pituitary to release FSH and LH. Now FSH and LH stimulate the ovary to produce the estrogen and progesterone in case of females. Now in the males, the FSH and LH are responsible for the spermatogenesis and production of testosterone. So at the level of the uterus, what do we see is on the second day, you have the egg recruitment or the follicles recruitment that start happening. At this point, the FSH and LH begin to increase. Now, before the follicular phase, you have also the estrogen that is increasing. Now, the estrogen is produced from the theca cells. The estrogen is produced from the theca cells of the follicles and the granulosa cells of the follicles as well. Now, these are responsible for production of the estrogen, which is seen in the follicular phase of the menstrual cycle. Now, at around the 14th day, when you have the LH surge, within the next 24 to 36 hours, the ovulation will occur. That means you have a mature follicle or the Graafian follicle which will rupture to form the corpus luteum. So ideally, in a woman of 20 with a 28-day cycle, on the 14th day, if she ovulates, within the next 14 to 15 days, she will bleed, unless this is interrupted by a pregnancy or it is interrupted by a hormonal imbalance. Now, in PCOS, as I said, the follicles do not ovulate. So, you do not have the corpus luteum which is formed. Now, the corpus luteum is the one which produces the progesterone. In a normal cycle, the progesterone which is produced will have a negative feedback on the hypothalamus, suppressing it and stopping the release of LHS and FSH. Okay? So this is how a normal menstrual cycle occurs. Now let us see in a PCOS, how does it change? So in a patient with PCOS, as I said, the follicles are not rupturing. Okay? So because the follicles do not rupture, you do not have the corpus luteum, you do not have the progesterone. So there is no progesterone surge. Now, the hypothalamus now continues to stimulate the pituitary to produce LH and FSH because it wants the ovary to ovulate. That is why LH and FSH increase. But LH increases more than FSH. Why? Because LH cells in the anterior pituitary are very much sensitive to the level of GnRH, which is produced from the hypothalamus. So you have in a PCOS patient, if you check them on the second day of their cycle, LH will be higher than FSH. Now, because the FSH is low, the follicles are not growing to form a mature follicle. So you see every follicle at different stages of development and maturation. Now, the increase in LH is responsible for causing an increase in the androgen levels. Because of the abnormal response, it also goes and stimulates the pancreas. Now, because it stimulates the pancreas, you have more of insulin which is produced. As and when your levels of insulin in the blood continues to increase, the body's sensitivity reduces and the patient develops insulin resistance. Now, increase in insulin further goes and stimulates the adrenal glands and increases your production of androgens, your DHEA, testosterone, DHT, all of these increases. Okay, so this is how we see physically the symptoms that the patient develops is because of the failure of the follicular development and related to the increased androgens as well as the insulin resistance which eventually develops in the patient. As you can see in this image, there are multiple cysts, multiple follicles at different stages of development. To summarize, in PCOS patients, there is no progesterone surge. So the GnRH level continues to increase. The GnRH pulsations increasing stimulates the LH cells in the anterior pituitary, which increases the production of androgens. The androgens increase is responsible for causing the hirsutism and acne in the patients, further increasing the insulin resistance in the individual. Insulin again stimulates the adrenal cortex to cause the increase in the androgens, and increase in the androgens further reduces the likelihood of the ovulation to occur. So, as we can see, because of the hormonal imbalance, we can correlate it with the morbidities and the complications that can occur later. The first important complication that can occur because of the anovulation is infertility. The second thing is because of the increase in the insulin resistance, the patient develops impaired glucose tolerance and type 2 diabetes, obesity and metabolic syndrome, even NASH, non-alcoholic fatty liver disease, cardiovascular disease, anxiety and depression, obstructive sleep apnea. Now, we can also get depression and anxiety in patients with PCOS because there is a simultaneous increase of prolactin. Now, hyperprolactinemia is also very frequently found in patients with PCOS, and you will see them coming up with symptoms of breast pain, mood swings, depression, anxiety, craving for sweets. This is a very classical symptom that the patient will tell you. Even hypothyroidism can occur in the same patient. So hypoprolactinemia, hypothyroidism, both can coexist together or either one of them. The next and the most dangerous complication that can occur is the endometrial cancer. So therefore, PCOS needs to be identified at the early stages, needs to be controlled and managed at the early stages. Now, what are the symptoms that the patient can present with? So the symptomatology is directly related to the age that the patient comes to you. Like a younger girl who is 13 or 14 years will present with initial symptoms of delayed menses, or the mother will complain that there is amenorrhea since the last 6 months and now there is bleeding since the last 3 weeks. She's passing clots with abdominal pain and severe breast pain. Okay, a 16-year-old may present with severe acne and hirsutism. A woman of 24 to 26 may come with the complaints of infertility. And if you go for women more than 35 to 40 years, will present with onset of diabetes or hypertension. So the symptoms are directly related to the age of the woman. So most commonly, because of the hyperandrogenism, we see hirsutism is the common symptom, that is the growth of hair on the chin and the other areas of the face and the body. Also acne that develops. Acanthosis nigricans. This is another symptom that occurs in patients because of the elevated levels of insulin, the insulin resistance and the high levels of androgens. Alopecia also will be found in women, and obesity. Now, coming to the diagnostic criteria for PCOS, to be diagnosed with PCOS, you have to have any two of the following symptoms to be present. First of all, irregular periods, excessive androgen symptoms, or the polycystic ovaries that is visible on the ultrasound. Now, irregular periods, by this I mean that if your menstrual cycle is more than 35 days, or there is amenorrhea for more than 4 months, or if you have prolonged cycles that could be scanty or heavy, or you have at least or less than 8 cycles a year. Second, the excessive androgen will produce the symptoms of hirsutism, that is excessive facial and body hair, adult acne, male pattern of baldness, and the polycystic ovaries that can be seen on the ultrasound. Now coming to, so homeopathy has a very major role and the greatest scope in cases of PCOS. Now, as I said, in PCOS, there is a hormonal imbalance that is occurring, and stress is the commonest cause for it. So because of the condition, because of the very nature of PCOS, it is not only that the ovary is the problem. The problem is multiple systems are involved. The problem is there are multiple factors that are getting affected, multiple functions that are getting affected, and the body's reaction. It is very important that we understand this body's reaction to find out the most appropriate, the most correct homeopathic remedy. So we need to study this individual at the mind level, at the physical level, at the family history, the past history, in order to find out the miasm, and with that to help you to find the most identical drug picture and the remedy. So modern medicine has limited scope in cases of PCOS, and homeopathy understands this individual at various levels, correcting the root cause of the problem. Now, as I said, that stress is the cause or the most commonly occurring reason in patient with PCOS. Now, we as a homeopath, we need to understand how the patient perceives the stress and how he reacts to the stress.